Today I'm going to talk about nutrition, what we should be eating, what are the best things to eat, and also about our weight. And I've had, unsurprisingly, a huge number of questions, and I have read them all and I will try and answer. Now, before I start, I am not a nutrition expert. I'm not a nutritionist. I'm not a dietitian. I'm just someone that enjoys healthy eating. And I wish I could tell you I had more training when I was an undergraduate about food, but in the 80s and 90s when I was an undergraduate at Manchester University, we only had very basic teaching actually about food and food choices and food for health, and a lot of it is self-taught actually. I've been working with all sorts of amazing people, reading lots of papers of course, and reading lots of textbooks too, and really a lot of what we eat is something that we decide ourselves. So what I just really want to start by saying is what I say might not be suitable for other people. So I'm just thought I'd give you just a bit of an overview. Before I get started, really thinking about perimenopause, menopause, thinking about the hormonal changes that occur. When you understand more about what happens with our hormones and how they work in our body, it's then easier to understand why we get weight changes in the menopause and perimenopause. And I've read quite a lot of papers saying there's no evidence that there's any weight change in the menopause. And actually, I don't think that's true. There is evidence that there is weight changes, usually weight increase during the perimenopause and menopause. And I've seen it firsthand in my clinical practice for the last 25 years as being a GP. Women have come to me and they said, Dr. Newson, I'm eating the same, I'm exercising the same, my lifestyle's the same, yet I'm putting on weight. Why is this? And I've checked their blood tests, they're not hypothyroid, they don't have any other reason to be putting on weight. And then suddenly it's that light bulb moment that it's related to their changing hormones. So then if you take a moment and think, well, what do the hormones do? What does estradiol, progesterone and testosterone, our three sort of so-called sex hormones that our ovaries produce? Levels decline as during the perimenopause and menopause. Now, estradiol and actually progesterone and testosterone are very good for our metabolism. So our metabolism is how we sort of use our energy, really. We all know people that have a really fast metabolism that can eat what they like and stay really skinny, and there are others that have a slower metabolism. And also a lot of the way we digest and metabolize food is related to our insulin, which is a hormone produced by our pancreas. So if we eat something that has a lot of sugar in it, our pancreas squeezes out more insulin to try and break down the sugar to convert it into energy. If we using our pancreas a lot more, then we get more insulin spikes and a higher predisposition for diabetes actually. Now in the menopause, it's a metabolic chaos for people without estrogen for many people, because our metabolism is changing, our basic metabolic rate is changing, but also the way we process sugar and secrete insulin changes, because all our hormones, so our sex hormones, work very closely with our insulin, they work very closely with thyroxine, like I've said before, but also our stress hormones, cortisol, adrenaline. And we know that if we're stressed, our sugar metabolism changes as well. So we've known for decades actually that metabolism changes in the perimenopause and menopause, and there's an increased incidence of type 2 diabetes in women who are menopausal, and women do often put on weight. And now the other thing is that our body needs estrogen, estradiol, which is the nice anti-inflammatory type of estrogen that's produced in our ovaries. It's also produced in our brains, and also actually our heart produces it, and some of our muscles and even our bones produce some estrogen. But when we have less coming out of our ovaries, our body does need estrogen. It's involved in more than 1,000 cell processes actually, and it affects every single cell in our body. So if our body isn't getting enough estrogen from our ovaries because we're menopausal or perimenopausal, then our body will try and make more. Now the other place it can make estrogen from is our fat cells, our adipocytes. But our fat cells they don't produce estradiol, they produce estrone, which is a very weak type of estrogen, so you have to make a lot of it to have an effect. But actually more concerning is that it's not anti-inflammatory, it's pro-inflammatory, which means it increases inflammation. And I'll just spend a little time telling you what inflammation means. You all know if you knock your arm, you're going to get a bruise, you get inflammation. But actually, there's more inflammation going on internally in our body. We have inflammatory cells which fight infection, but they also fight diseases to keep us healthy. And our inflammatory cells, you may have heard of cells, are white blood cells essentially, but you might have heard of cells called macrophages, neutrophils. There's even natural killer cells, quite a dramatic description of cells. We've got monocytes, we've got lymphocytes. They're all different, they all have different actions, and they're very clever, our immune cells, because they also produce chemicals called cytokines that are a bit like a sort of poison, if you like. They'll kill any nastiness that goes on. So we're obviously constantly exposed to germs and viruses and bugs, and these cells basically kill anything that's abnormal in our body. But they also reduce inflammation. So if we don't have inflammation, we're less likely to have diseases. When we've got low estrogen in our body, low estradiol, that is, these immune cells change to be pro-inflammatory, so they increase inflammation. And when there's more inflammation, they don't work as well, they don't secrete the same cytokines, and they can reduce in number. So it means if there's inflammation in the body, they won't calm it down. If we've got good estrogen, so the estradiol in our body, then our immune cells actually can then fight infection better. They work better with estradiol in the body, and they can actually, estradiol is amazing. It will actually help increase the number of our immune cells. It can genetically reprogram them. It can also change the chemicals, the cytokines that these white cells produce. And so if we don't have estradiol or enough estradiol in our body, I've already said our body then says to our fat cells, give us some more, give us some estrogen, and it will produce some estrone, the pro-inflammatory estrogen from fat cells. And it's usually fat cells that are in the midline. And I know it happened to me when I was perimenopausal and I was feeling really tired. I was feeling sort of very fatigued, very forgetful, lots of mood swings, lots of migraines, muscle and joint pains. And then even when in the car, I'd have my seatbelt on and I think, oh, I've got this extra tyre around my middle, which I wasn't used to. And even my mother one day said, oh, Louise, you put on a bit of weight. It's the last thing you want to say to a menopausal or perimenopausal woman is that you've put on weight, especially when you know you have, without changing anything. And there was me, having been told for years, perimenopause, you don't increase weight. I knew I did. And I knew I wasn't doing as much yoga practice as I have done in the past, and I knew that I wasn't eating properly, and I knew that I was not sleeping well, and all those things can change your metabolism and mean you put on weight. But I knew there was something else going on. And then it makes sense. If your body wants this estrogen and gets it from its fat cells, it's going to lay down more fat. And obviously we know that people are more likely to be overweight and obese during the perimenopause and menopause, also increase incidence of type 2 diabetes, like I said. So that's something that regardless of what we eat, regardless of how we exercise, if we don't have hormones, a lot of people, not everyone, some are lucky, but a lot of people tend to put on weight because the body wants estrogen to try and work. It's always worth making sure if you do put on weight that you haven't got an underactive thyroid or any other condition that's resulting in increasing weight. But that is the commonest reason why people do put on weight. And so then what can we do about it? And a lot of people have asked, does going on HRT mean that I'm going to put on weight? Now, I've already said before, and I'll say again, there are different types of HRT and there are different doses. We're very fortunate now that in the NHS, as well as privately, we can prescribe these natural body identical hormones. So we can prescribe estradiol, the anti-inflammatory nice estrogen, usually through the skin as a patch or gel, or there's the spray that goes straight into the bloodstream and stays at estradiol, so it goes all around our body, in our bloodstream, and helps every cell in our body. Now, in the old days, like 20, 30, 40, 50 years ago, the only estrogen that we had was a tablet estrogen, and the tablet estrogen then actually converted to estrone, the pro-inflammatory estrogen that I've just spent a bit of time talking about, which it actually isn't great. There was estradiol as well, but there was some estrone. So some people found that taking tablet estrogen either was neutral for their body weight, or actually they increased weight, and it might have been related to the estrone. The other thing is, for those people that take progesterone, and we always give progesterone to people who have a womb, and other people can benefit from progesterone as well, that we give the natural body identical progesterone, the same progesterone as we produce ourselves naturally. In the old days, with the tablet estrogen, the only progesterone we had was a synthetic one, so a man-made progesterone, if you like, so it didn't have the same chemical structure. So you might have heard of progesterone such as medroxyprogesterone acetate or norethindrone, and these don't work in the same way. And a lot of people find that they get bloating. So bloating is not the same as putting on weight, but a lot of people, when I used to prescribe it many years ago, they'd come back to the surgery and say, I've put on 1/2 stone in a few weeks. I've literally ballooned out. Now that's not fat that they're putting down, that's actually fluid retention. So it's worth always thinking, how quickly am I putting on weight? And often fluid retention is in our legs and our ankles rather than in the midline. Sometimes people notice it even on their face as well. So it is worth thinking, what type of HRT am I on? And if you are on the combination tablet, it might be a time to think about changing to the natural hormones. The other thing is, we know that and I've said before, it's really important to get the right dose of estradiol. Our skin is a barrier, and so it's not made to have drugs pushing through it. But estradiol is small, it can go through the skin, but our skin changes in thickness, in temperature, depends about the blood supply going through it. If we're using a patch, it might depend where we stick it. If we stick it onto our lower back compared to our bottom, compared to our thigh, studies have shown that it gets absorbed differently. We know, I've already said, if you've got low estradiol, it switches on your inflammatory cells to become pro-inflammatory, which is not what you want. So I've seen lots of people in the clinic who are on, they think, the maximum dose of estrogen, and they're still getting lots of symptoms. I do their estrogen or estradiol levels and they're very low, which fits in with the clinical picture. And then I might change them, say, from 100 microgram patch to 4 pumps of gel. So exactly the same dose equivalent. And then suddenly they go, wow, I feel so much better. Their estradiol levels come up to a normal, in the normal range. Their symptoms have improved, and actually their weight improves as well. And that's just because they're absorbing the gel better than the patches. Or some people, we might increase to say 150 micrograms of patches, and it's quite safe as long as we monitor symptoms. The levels can be a guide, but also we know that some people, if they start a low dose, for example, a 50 or 75 microgram patch when they're perimenopausal, they're still producing some estrogen when they're perimenopausal. So once the person becomes menopausal, it's quite common that the dose needs to increase. So it's always worth, obviously, reviewing your dose with your menopause specialist or your doctor, nurse, pharmacist, which might need changing with time. So a lot of people actually find that they lose weight when they're on HRT, whereas the older types, they might have know people that have had them or tried them themselves and found that they either didn't lose weight or that they put on some weight. And it's one of the first things that many people say to me is, I'm not going to put on weight with this HRT, am I? As I've said before, it can take 3 to 6 months to get the right dose of HRT, and even when you're on the right dose, it can take that length of time for your body to adjust and adapt. So if there are any weight changes initially, or there's no sort of magical weight loss, then just persevere as long as your symptoms are improving as well. So estradiol, the right dose. Progesterone, even the natural progesterone orally gets broken down to other types of progesterone, and some people find that they have some fluid retention. So quite often we suggest to have the progesterone vaginally. It's an off-label use, but there's lots of things in medicine we do off-label. It's still safe, and if it's inserted vaginally, the pure progesterone then gets absorbed through the mucous membranes of the vagina straight into the bloodstream. It stays as progesterone. So if you are feeling a bit bloated or have some fluid retention with tablet progesterone, it might be worth speaking to your healthcare practitioner about having it or using it vaginally, and there are different doses that we use. Quite a few people want to know about testosterone, the other really important hormone that we produce in our ovaries, also produce it in our brains as well. When we're younger, we produce more testosterone than estrogen, and levels decline with age. Many people find that when they don't have testosterone, they're not so able to build up muscle, their stamina reduces, their sleep reduces, they might have muscle and joint pains, obviously libido can reduce as well, they might get more headaches. All of those are stacked against us if we want to exercise and we're experiencing those symptoms. The guidelines are clear that if we give HRT and people still have reduced sexual desire, we can add in testosterone, and I've done a whole Instagram live, which is now on my YouTube, about testosterone. So I won't talk about it in detail, but suffice to say, in our clinical experience, many women tell us that they find it easier to lose weight or change their body shape when they're using testosterone as well. And that's no surprise actually, because often people find that their energy improves, their motivation improves, their sleep improves, but also their muscle strength improves as well. We know we have testosterone receptors in our muscles and our bones. So a lot of people find that their exercise performance has declined. Then they're on HRT with testosterone and they can get back exercising, even actually better than they have done sometimes for a few years if they've been perimenopausal for a little while. So optimizing hormones is really important, but it's not everything. So there's no point, for example, me taking HRT and eating chips 5 times a day, drinking alcohol, smoking, having fast foods. It's just not going to do it. And our metabolism changes because we get older as well. I look at what my teenage children eat and I look at what I eat, and there's no way we eat the same. And if I ate the same as them, I know I would put on weight. So having the right diet and the right foods for you is really individual. But there are certain things that I think we should all be doing and thinking about. It's so much easier to eat badly than it was when I was growing up in the 70s, because we're just exposed to fast food, to processed food, to eating any time of the day or night. And it's not just what we eat, it's drinking as well. The number of drinks that are available now that are bright colours, they're fizzy, they might be juices, they actually can really affect our weight more than sometimes what we eat. So when we talk about diet or what we eat, we've got to think about what we drink as well. It's a fallacy if we think that like zero whatever Coca-Cola or zero sugar has got might not have calories in it, but it's full of chemicals. And I think very much in a very basic way. But if you think of all our food types, our body is designed to eat fresh food, food that it recognises, food that it knows how to process. If you're giving it a chemical, whether that's a chemical drink that isn't a natural chemical, or whether it might be some processed food that has been processed so much it's basically a group of chemicals. If your body doesn't know and recognise and know how to digest it, then it's just going to form reactions in our body and end up being laid down as fat, I'm afraid, because your liver won't know what to do with it. And we know there's some great people out there who are nutrition specialists who talk about processed foods. I've done a podcast with Henry Dimbleby before, and also Tim Spector, of course, Michael Mosley I've done with his wife Claire, talking about food, and obviously there's Dr. Rupi, who's amazing, and also Emma Ellis Flint, who isn't a doctor but she's a chef and a nutritionist, and she's definitely worth following because she makes food look so enjoyable, as does Dr. Rupi. When they're cooking, they've just got smiles and energy in their faces, and you just want to do what they're doing, and they make it very simple as well. So for a rule of thumb, I always think I'm only going to eat what I recognise. So if there's something that I'm eating and I know what it is, that's fine. But if it's something that's been sort of man-made, if you like, then don't know what's in it. So even if it's a ready-made pasta sauce, for example, you've got no idea what's in it at all. And so I end up avoiding things like that. I'm really obsessed with what I eat, and that's because I have migraine. So I know that if I went and bought a meal deal and had it now, I would get a migraine in a couple of hours, because any sugar surges in my body, any processed food, it just ends up a migraine. So I'm lucky but not lucky, because I have to be really careful what I eat. And it's so easy when we're hungry to just think, oh, I'm just going to have a little snack. It doesn't really matter. I haven't got time to cook. I'm just going to have what's in the cupboard, or what I might have bought for my children's packed lunch or something like that. But actually it will backfire on us. We should be really looking. So eating in the season is really important. Using fresh fruit and vegetables. There's that old cliche of eating the rainbow, but it's really important that we eat as much as possible. So I don't think we need to count, because you'll read different things about the number of fruit or vegetable portions we should have in a day or a week. We should have as much as possible. And I always say to my children, we should be adding things to our food, not taking it away. So we should be adding herbs and spices. We should be adding seeds. As long as you haven't got a nut allergy, add nuts. They're a really good way of increasing nutritional value. We've also got to feed our gut microbes as well. And in my book, the hardback and the paperback that's coming out, we've updated quite a lot in there. There's quite a big section about prebiotics, probiotics, how to get a healthy gut microbes, because we've all got these little microbes, these bugs in our bowel, in our gut. And if we make them happy, there's actually a really lovely pathway that goes up to our brain. So if our gut microbes are happy, then we're generally happier as well. It can boost the way we feel, but it also helps reduce inflammation as well. And we know that our hormones affect our gut microbes, but actually what we eat is really important for feeding them or killing them. So if we eat processed foods, they don't get the nutritional value, these bugs, and they end up reducing in number, and that can turn against us and increase inflammation. We know there's increasing studies that people who eat a lot of processed food have an increased incidence of all the inflammatory conditions, which include heart disease, osteoporosis, diabetes, dementia, clinical depression. They're all inflammatory diseases, and I'm sure you've heard me talk before that they're also diseases related with menopause, because low estradiol, as I said earlier, is associated with inflammation. So we want to be looking at any ways of reducing inflammation. Taking HRT, of course, can reduce inflammation. Reducing processed foods will reduce inflammation, and really, really important. And eating the right food, so eating fresh food, eating food that we recognise, trying not to drink fizzy drinks. Even juices are not very good to drink because they've got so much sugar in them as well. So try and stick to water. Alcohol in moderation. Glass or two of wine is okay, but you have to not overdo it. And if you're having mixers in drinks, just be careful about what you're having in those drinks. All of those really, really important, and it goes without saying we shouldn't be smoking as well, but they are really important in our gut microbes, and it will help our metabolism too. Protein is really important. Increasingly people talk about protein and how important it is, especially when we're menopausal as well. And many people don't eat meat. Obviously we've got fish, protein in fish, but some people don't eat meat as well. It's really important to look at your protein content, and most of us probably don't have enough protein. So really important. And I've been more interested in food as I've had my children, because it is a real responsibility when you have children to feed them well, and just reflecting, thinking, it's no good you eating really well and them not eating well, or you looking after them and not looking after yourself. So it is really important. Someone asked about sugar cravings. Is it a thing? And it absolutely is a thing. Many people have had sugar cravings before their periods, and that's the time when our hormone levels are low, especially estrogen and progesterone, and people do get this real hunger. And it can be very common again in the perimenopause and menopause when hormone levels are fluctuating, but when they're low as well. And so it can be very difficult. Looking at your GI index of foods is really important. And so, for example, if I was hungry and I had, I don't know, a bar of chocolate or something that's going to increase my sugar really quickly, I might feel a bit better for a few minutes, and then I'll get a big dump, sort of a sugar crash again, and then feel hungry again. Whereas if I had a handful of nuts or seeds, or I had a flapjack or some oats, it's going to have less of a big spurt, less of a big spike, and then gradually plateau down my sugar level. So it's a lot. You have to be really careful what you eat. So if you do have a craving, firstly have a drink. Make sure that you're not thirsty, because lots of us think we're hungry. Have a big glass of water and actually don't feel quite as hungry after that. But have a snack. I always have some nuts in a bag in my car, or in my bag. I just put some in a little plastic bag, because nuts are really expensive if you buy them when you're out, but if you buy them in bulk and just have some, then if you're hungry you just have some. And I always take a piece of fruit. So coming home from work, I'll always eat an apple, and then I know I've had an apple every day, but it's in my car and I always feel hungry on my way home from work, and it means that I don't get in and want to eat straight away. It gives me time to prepare something. And I always batch cook, so everyone who knows me knows that I always cook in bulk and then divvy it up and put it in the freezer. So I know that I've always got food, not just for me, but for my children as well. And I'm very fortunate, I know that I have a freezer, but just knowing that you've got some quick recipes that you can just go to very quickly, rather than reaching for something that's processed, it's so much better. And honestly, you will feel so much better if you eat well. It's taken me many years to change my diet, but I wouldn't go back. Finally, before I finish, just to mention about exercise. Again, there's been quite a lot in the news and different research studies saying that if we exercise, it doesn't change our weight. I find that quite hard to believe, actually, because anecdotally or personally, either myself or with patients or friends, I know that when they exercise, their body shape does change. And it might be that they're changing what they eat as well. So I'm not going to say, there's definitely studies, because I don't think there are good studies. And studies like that are very hard, because when you're relying on people to self-report on what they eat and how they exercise, we all either exaggerate or underreport what we do. So it's very hard for the researchers to know. But certainly exercise is beneficial for our mental health. Exercise is good for our gut microbes. They're a lot happier when we're active. And it's good for building up our muscles and our bones anyway. So we should be exercising, but finding the right exercise is really good. Some people find that when they do HIIT classes or the high intensity workouts, it's meaning that they're releasing more adrenaline, more cortisol, and it might be more stressful for them. Stress can increase weight, especially in the midline. So if people are really struggling to lose weight and they're eating everything properly, they've got their hormones balanced, then maybe look at the type of exercise that you do. Doing exercise that incorporates some mindfulness, some toning of the muscles, some strength as well, is all really important. Obviously I'm biased towards yoga, but yoga, Pilates, you can't go wrong if you do that, but you might want to incorporate it with another type of exercise. But just think, because some people do need to change their exercise as they get older and as their hormones change as well. Finally, someone was asking about fatty liver. So non-alcoholic fatty liver disease, which is NA, non-alcoholic, FLD, so non-alcoholic fatty liver disease, NAFLD, bit of a mouthful, but basically it means liver disease and it's not due to alcohol. And when I was doing a liver job many years ago in Manchester as a junior doctor, most people would come in with liver disease who are alcoholics. So obviously alcohol is a poison to the liver if it's had in excess, and you can get swelling of the liver before you get this shrinking and cirrhosis. Increasingly now we're seeing this non-alcoholic fatty liver disease, and guess what? It's more common in women, and guess what? It's more common in women in their 40s and 50s. So what do you think is related? Of course it is related to the perimenopause and menopause. and we're seeing more than we used to 20 or 30 years ago because less people are taking HRT. As you know, the numbers have really dropped and not come up to how they were before the WHI study. So there's a lot of people who are having an ultrasound for an unrelated cause often, and then being told they have a fatty liver, and that can be related to the low estrogen that occurs. And so many people find that their fatty liver will improve with hormones, and it's another reason why we're very fortunate that we can have the estradiol through the skin straight into the bloodstream, so it doesn't have to get metabolized and broken down by the liver. So HRT, as the natural body identical hormones, are safe with fatty liver disease. And then the final thing, I just forgot, someone was asking about the difference between HRT and the contraceptive with weight gain. A lot of people find when they have the combined oral contraceptive pill or the progesterone-only pills that they put on weight, and that's often because it's blocking estradiol and also blocking testosterone as well. So it might be worth, if you really feel that your weight changes are due to your contraceptive, then if you're perimenopausal, of course you can take body identical hormones, although they're not contraception, or you could talk about changing to a different type of contraception, which might make a difference as well. So it's just something else to think about. So that's half an hour. I hope that's been useful. Like I say, there's lots of good people to follow for really detailed information. I wanted to keep it really quite loose about nutrition because I'm not a specialist and I don't want to give inaccurate or confusing advice, but just to keep things simple is the most important thing, and actually enjoy food. I really like cooking and I love it even more when people cook for me, but I like enjoy the flavours. I like to feel healthy when I cook and when I eat as well, and I like to sort of not feel hungry as well. I also, looking at time restricted eating for some people can be very beneficial. So eating your supper a bit earlier, having longer before your breakfast, many people can find that can be transformational for their weight, even if they're eating exactly the same. And there's different ways of doing it, but you've got to do what's right for you. We're all individuals. We all can make our own decisions, and our decisions might change with time. So what we're eating now, or what we're doing to help our symptoms now, or what we're deciding in the future might be very different, and that's fine. But just enjoy what you're doing, keep happy, keep healthy, and I'll see you next week. Next week I'm going to talk about surprising symptoms that occur in the nervous system, so in our brain and our nerve system, because when I did unusual symptoms before, I couldn't get through everything, so I thought I would just focus on symptoms that affect our brain and our nerves as well, and talk about that next Sunday. So enjoy the rest of your evening and have a great week, and I'll put this on my Instagram and it will go up to my YouTube as well. So thanks ever so much for joining.